Today we're going to talk about urinary tract infections in pregnancy. UTI, perhaps one of the most commonly known acronyms in medicine. UTIs, or urinary tract infections, happen when bacteria get into the urethra, that pipe that brings the urine out of the bladder, and travel up into the bladder. The urinary tract is the group of organs in the body that handle urine. It includes the kidneys, bladder, ureters that communicate the kidneys with the bladder, and the urethra. If the infection stays just in the bladder, it is called a bladder infection or a cystitis. If the infection travels up past the bladder and into the kidneys, it is called a kidney infection or a pyelonephritis. Bladder and kidney infections are both types of UTIs. Certainly, bladder infections are one of the most common infections, causing symptoms like a burning feeling with urination and the need to urinate frequently. Kidney infections are less common than bladder infections and can cause similar symptoms, but they can also cause fever, back pain, nausea, or vomiting, and they can get complicated. Both bladder and kidney infections are more common in women than men because of the anatomy. Most cases of bladder infection in women are uncomplicated and easily treated with a short course of antibiotics. Kidney infections can also usually be treated at home with antibiotics, but treatment typically lasts longer, and in some cases, kidney infections must be treated in the hospital with intravenous antibiotics. UTIs are common during pregnancy, and when a pregnant person gets a bladder infection, it is more likely to lead to a kidney infection. This might be caused because the ureters, the tubes between the bladder and the kidneys, get wider during the pregnancy, making it easier for bacteria to travel even up higher. When a person has more bacteria than normal in the urine, but the person does not have symptoms of infection, we can call that asymptomatic bacteriuria, which is bacteria in the urine but without symptoms. In pregnant people, we check or screen for this as part of routine testing. This involves a simple urine test and is usually done near the end of the first trimester. It is important to identify it, as it may need to be treated to avoid a progression towards an infection with actual symptoms. Symptoms of a urinary tract infection depend on which part of the urinary tract is affected. As I mentioned before, it could be the bladder or the kidney. If you have a bladder infection, symptoms can include pain or a burning feeling when you urinate, the need to urinate often, the need to urinate suddenly or in a hurry, or even blood in the urine. If you have a kidney infection, you might have those symptoms too, but kidney infections can also cause fever, back pain, nausea, or vomiting, and show you very, very sick. Kidney infections during pregnancy can sometimes lead to more serious problems, including sepsis, which is when an infection travels throughout your entire body. Breathing problems with the need for hospitalization, or even the possibility of early delivery, that is before the completion of the pregnancy. If you have a bladder infection, you will probably need to take antibiotic pills. Most are taken for 3 to 7 days, but the exact schedule depends on which antibiotic you get. Your doctor will prescribe one that is safe to take for you during the pregnancy. But it is very important that you take all the antibiotic pills, even if you start feeling much better. After you're taking the antibiotics, your doctor might test your urine to make sure the bacteria and the infection completely is gone. If you have a kidney infection, it is so serious that you will probably need treatment in the hospital with intravenous antibiotics until you're able to go home, and then continue to take antibiotic pills. When you have a kidney infection, your doctor might have you continue to take daily antibiotics for the rest of the pregnancy on a daily basis to prevent the infection from coming back. If you get treatment, chances are very good that your baby will be healthy. It's not going to affect your child. However, there is a small risk of certain problems if you have bacteria in your urine during pregnancy, and these include preterm labor, which is when labor starts before 37 weeks of pregnancy, or having a baby that weighs less than it is expected. Remember that babies who are born preterm or underweight can have additional health problems. Sometimes, if you get UTIs, especially if they tend to happen after sex, your doctor might prescribe you antibiotics during pregnancy. Taking one dose of your antibiotic after sex might help in those instances prevent getting a UTI. Remember also that drinking plenty of fluids can also prevent UTIs. This is true whether or not you're pregnant. So these are the 5 things that I want you to remember about UTIs in pregnancy. Urinary tract infections, or the presence of bacteria in the urine, may or may not have symptoms. Infections can happen in the bladder or the kidneys. Asymptomatic bacteriuria is the presence of bacteria in the urine without symptoms. Urinary tract infections can cause complications during pregnancy, and proper screening can help prevent those. So keep an eye, and your doctor will be checking you.